Welcome. I'm Dr. Doug Evans, and we're continuing our series of videos with patients who have a really inspiring and important story to tell. I'm lucky enough to be here with Dr. Syed Hussain today. And Dr. Hussain, thank you so much for joining. As everyone knows in the department, I have trouble calling my patients by their first name. So I may use a little bit more of Dr. Hussain today than usual. But he's a pancreatic cancer survivor, also a physician, which is very important and provides a unique perspective. And I thought it would be good to start out with a little bit about you and perhaps a little bit of your life story, and then we can get to the pancreas cancer diagnosis and how you were treated.
Thank you, Dr. Evans. It's a pleasure to be here, and in no small part thanks to you that I'm here today. But yes, I trained as a medic a long time ago, went to medical school out in the UK, and then left the profession shortly after training and went on to do other things. At the moment, I work with the elderly and run some care homes for those with dementia.
And where in the UK did you grow up?
In South Wales, not far from Cardiff. Beautiful place with a really good, strong sense of community. My dad was a physician, a general practitioner, and a lot of the families that we sort of hung around with and grew up with were also sort of GP, doctors, and a lot of their children went on to become doctors too.
Yeah, I remember from my time in the UK that you go into medical school straight from your equivalent of high school.
Yeah,
right?
so straight after A levels. It's a very big decision to make at 17.
Yeah, absolutely.
And then it's a 5 or 6 year course.
Yeah.
Straight out of high school.
And then how did pancreas cancer come about? What was the story there?
Back in the beginning of January last year, so January 22, I started to get some abdominal discomfort and pain after I was eating, and I was on aspirin at the time, and I was just thought, well, perhaps it's an ulcer. I started treatment for ulcer and had a gastroscopy. They put a scope in to have a look, and that came out clean. So the next step was a CT scan, and then by the time I had that scan, I'd already developed some back pain, and that was happening at the time. So out of the blue, to be honest, wasn't expecting, wasn't feeling particularly unwell until the pain started, and
you knew there was something wrong there.
Yeah, I knew there was something wrong. I was pretty sure it was perhaps some sort of ulcer because of the medications I was on put me at high risk for that. Stress to do with work and other things also put me at high risk for that. And certainly cancer wasn't something that I thought was even very low down the list of possible things that it might be.
Yeah, we always think that it's whatever it is, it's not going to affect us, and that's a very common way of thinking about this. And of course, pancreas cancer, as everyone knows who has watched a lot of the information that we try to provide in videos and in print media, in the overwhelming majority of cases, pancreas cancer just affects normal, healthy, otherwise good people. Very tiny percent is due to long-term tobacco exposure, the Patrick Swayze phenotype. Right. A tiny bit is due to diet and obesity, such as occurred with Luciano Pavarotti, we think, and then a tiny bit is due to inherited conditions or genetic predisposition due to known and unknown genes. But the majority of people are just get pancreas cancer for no reason. So, how did your treatment start?
So, initially they performed the scans. I was told it was locally advanced disease and it couldn't be resected unless it responded to treatment. And I started on FOLFIRINOX chemotherapy. And I believe that by the time I ended up having 9 cycles of that therapy. And it was difficult, but perhaps I tolerated it better than others. And that once you start counting down, there's only a limited number of cycles. So I found that after sort of cycle 3, I was a third of the way through. By cycle 5, I was more than halfway through. And the time just went by, and it got progressively a little bit harder. But I also had a very good oncologist who said, Anjum, your one goal throughout this is just to maintain your weight.
Yeah.
And that was my goal throughout the chemotherapy, was just to maintain my weight.
Yeah, it's interesting how many institutions use a more prolonged course of FOLFIRINOX. One of the things that we have championed here is what we call an adaptive approach to neoadjuvant therapy. So we try to determine whether the chemotherapy is optimal for the tumor. In other words, is the tumor in the patient, are they sensitive to the chemotherapy or not? And certainly patients can occasionally get long courses, but just so everyone watching the video knows that some patients may receive 4 cycles, sometimes receive a different chemo. Some people may receive 8 cycles, and in your case it was 9. And then there was the transition to radiation, correct?
Yes. So I had radiotherapy here with over a 3-week period with some a chemo neoadjuvant as well with that. And again, that went, it was a lovely, lovely team here actually.
Yeah.
And I wouldn't say I would look forward to coming into my sessions, that's probably overstating it, but it was certainly a good experience while I was here. And again, by the end of the 3rd week, as you approach the end, you do become more tired, and it does have a bigger impact on you.
Exactly.
But again, you're counting down the sessions.
And here at MCW, there are basically 3 ways in which the radiation is given, and Dr. Erickson and Dr. Hall perhaps won't approve of how I summarize this, but and I think Beth Erickson took care of you, and she is just all world, and as is Bill. And but the radiation can be given over 2 weeks as part of a clinical trial, which is referred to as SBRT. It can be given over 3 weeks. A regimen that was initially developed in the Netherlands by the Dutch, which is, I think, the program that you received.
Yep.
And then it can be given in a more traditional way over 5.5 weeks. Those are the 3 basic ways in which radiation therapy is given at this institution, and really at many institutions around the world. There are not an infinite number of ways that's given. And then there was a break after radiation, correct?
Yes. So, and I can't quite recall, maybe a 3 or 4 week break between radiation and I went back to the UK, which is where I live. So I spent a little bit of time with my family, and then before I came back here for surgery.
Yeah, and then obviously the operation went fine with respect to your here, and no major complications of the operation. And the reason I wanted Dr. Hussain to do this video, other than the fact that his story is really important, and I think it shows you the courage and strength that it takes to get through such treatment, but also the fact that he does represent a challenge with maintaining weight and nutrition after surgery, which is really the current problem that we have with big operations on the abdomen for patients with cancer. While occasionally there is a major complication on the day of surgery, that predominantly occurs in the movies, on TV. It doesn't occur that with any significant frequency at all in real life, almost never. Patients virtually always recover from the operation. What the challenge is the longer term effects, and the larger the operation. And we cover this in an episode of Pancreas School. When we do a big operation and we have to remove a lot of the nerve that goes to the small intestine and the beginning part of the colon, the nerve functions as a brake pedal in normal life. And when that brake pedal is released, food and other nutrients go quickly through the intestinal tract. It's hard for them to be absorbed, and therefore the good news is that the tumor is out. The not so good news is that a big operation was required, oftentimes with blood vessel reconstruction, and therefore things move a little quickly through the body. And what has been your experience with this, and how are you dealing with this now?
The surgery went really well, and I bounced back really quickly, in the sense that I think I was up walking the same day, and was discharged within 6 days of the operation, and all felt good. And I was on quite a restricted diet to begin with, following the nutritionist's advice. and was looking forward to getting back to a normal diet pretty quickly and moving on from there. I have found it to be a much slower pathway in terms of recovery than I was expecting. And I think, Dr. Evans, that's no fault of yours. You'd explained a number of times that maintaining weight post this operation is quite difficult. It's just that before the surgery, I was always focused on only hearing the bits where you talked about removing the cancer.
Yeah,
Absolutely. And so by the time it's been what, six months now since the operation, and over the first couple of months, despite following all the advice, I found I was still losing weight at quite a significant rate. So I've lost about certainly in excess of 30, maybe 35 pounds, 35 to 40 pounds from my pre-surgery weight. And whilst I was trying different things over the first couple of months, I think time is one of the big factors.
Sure.
In things improving from.
There's an adaptation that probably occurs.
Yeah.
Yeah. And right now, the medical regimen is a combination of medications to prevent the diarrhea, so anti-diarrheal medication, combined with pancreatic enzymes, right?
Yes.
And how many enzymes are you taking, and how are you taking them? Because I think that's another area that's so misunderstood by so many patients.
Okay, so in terms of the pancreatic enzymes, I'll be taking maybe between 50,000 units and 100,000 units per meal, depending on how big the meal is or how fatty it is, to a certain extent. And what I've recently done is started sort of opening up the capsules and putting them in a bit of yogurt and enjoying that with the meal. I find that the small changes make a difference. And my stools are sort of better formed, and I have fewer movements a day when I do that. Earlier on, after the surgery, it was quite random in terms of how my stools formed and how I did had relatively little to do with what I was eating and how I was eating. And I think as things have healed, now when I make those changes and persist in making those changes, I do feel the difference.
Yeah.
So I've now gone back to trying things that I tried early on but didn't make a difference. But now when I try them, I find that they are making a difference.
Yeah, so important. I think one of the other things that you've done so well is you've had an amazing attitude through all this. Which is the other reason I wanted to do this video with you, because I think so many people have an initial euphoria in the first few days after surgery, right? That the tumor is out. People weren't really sure that the tumor was removable at the time of diagnosis. There was always that concern. So there's that initial euphoria, and then when they realize that they have to put in all this tremendous effort into recovering, after a number of months of chemotherapy and then radiation, and all of this is cumulative, the fatigue can be significant, and then it's very easy to get a little depressed, a little frustrated. Obviously, none of this is fair. One of the amazing aspects of just you and your personality is that you've been able to focus on the goal, focus on the target. Your attitude has been almost superhuman, and it would be great if we could bottle this and make it a medication, and we could give it to patients. How have you been able to take such an analytical and positive approach to your recovery?
So there are probably a number of aspects into that, right? So firstly, my training and background, I understood that cancer is not personal, right? It's not that again. It's one or possibly a small number of cells that have developed a life of their own and are causing an issue. So it can happen to any of us at any time for any reason, and but for the grace of God go I, as it could happen to anyone at any time. It's certainly not personal. Second, the support I've had from friends, colleagues, family has been second to none. They've really come out, and funny enough, it gave me a license to lean on others, something that I'm not keen to do in general, but then being able to lean on others and have their support, my mum's support and so forth, that's made a big difference. But thirdly, in terms of the approach to this and attitude to this, I have young children, and I want to be around for them.
Yeah.
But more than that, I figured out early on that the outcome here is binary. I'm either going to survive it or I'm not, and there's no reason to be, as in either way, it made sense to me to take it positively.
Yeah.
So if I am going to survive it, there's nothing to be upset about, and if I'm not going to survive it, then I need to really enjoy and make the most of these times.
Yeah.
And being then orientated towards goals, yes, each goal at a time gave me something to focus on, and I started losing weight at what I thought was quite an alarming rate shortly after recovery and discharge. And then it was fine. What do I need to do to address that? And we had some conversations about essentially being bolder with my medication and bolder with what I was eating.
Yeah.
And to certainly, I mean, follow the advice that you're given, but also feel free to work out what works for you.
Yeah, such important advice, no doubt, for anyone watching this video, for all of our patients and their families. It's just so important. One of the things that, as we get older, one of the things that we get used to doing is just is not worrying about kind of the schedule of the day, right? I mean, we have things going on, life is busy and everything else, and yet for you, this recovery has been pretty much a full-time job. The scheduling your medications, your meals, your the appropriate numbers of calories and protein. How have you, this will probably be my last question here for you, and thank you for all the time devoted to this, but how have you been able to take the time that you had previously devoted to something else, work and everything else, and put that into place?
So again, I was very fortunate that I have the support of my mum, who's living with me, and some of these changes would have been harder without the support of family. And I think the key thing that's made a difference for me is focusing on those smaller meals. To sit down and slowly enjoy 5 meals a day, it takes a lot of planning and a lot of time out of your day, rather than grabbing and going and eating quickly on the move, maybe 2 or 3 meals a day. So it has involved the support of others. It is involved and people stepping up in terms of looking after some of my work, in terms of my work commitments. You have to, well, put it this way, on the days that I don't, or am not able to do it, there's a price to pay, and I notice it.
Yeah, absolutely. Well, Dr. Syed Hussain, thank you so much for joining us today. Your story is amazing, and we're so much the better here at the Medical College of Wisconsin for being able to get to know you and develop a friendship with you as well.
No, thank you, Dr. Evans, and yourself and your entire team here, I'd say, are second to none. And I've had a fair amount of experience here and elsewhere.
Well, thanks so much. Thank you.